Ashley, do you want to go in the meantime? Do you want to talk to us about what you're hoping you're going to be achieving if you were elected?
Sure. I was hoping to have some nice, robust engagement with some of our other candidates.
I'm sure that Franklin will give you a run for your money, though.
Yeah, we are good friends, so I look forward to engaging with him even post the elections. The same with Colleen and Morris and some of the others from the other political parties. Yeah, so, but here we are, and so we need to make good of what we've got.
One of the questions that I'd like to have as just a general conversation is that we know that there's a problem with the health services and the queues and the old ladies who are 80 years old who've got to stand all day. And I do know that we've got some actions that is being done to be able to manage a bit of that.
Right.
The question is, I think Reverend Franklin's position is clear. He's already stated it. Do you want to talk to us about how you would be able to assist with that burden, Ashley?
Absolutely. I think that, look, the reality is that we are all appalled by some of the service delivery, and that being one of the top matters of concern, because it impacts our mothers, our seniors. One which I am very, passionate about, because I run a seniors club as well, and it's so disheartening to hear that they have to be running around and sometimes being shifted from the town centre or the Mitchell's Plain Day Hospital to smaller sites like out in the back of Eastridge, where they are fearful to go to, but have to go even now with regards to the vaccination. And it has been a difficult challenge. I've picked up and transported some of them during the past couple of months, just to ensure that they have safe passage. Now, if we can't provide basic services such as this for our seniors, their tablets needing to be collected, them to be receiving some type of follow-up visits for medical checkups, then we are going to be failing dismally, because those are our pillars of our community. And I am insisting, or when I am, or if I am elected, my main cause or main focus would be to challenge the healthcare system and to look at viable alternatives. We have best practice that we can fall back on. There's a global practice where medication can be dispensed and delivered to the homes of our seniors. Why do they need to go and stand in these long queues, and sometimes in dreary weather have to wait to be seen? And with COVID regulations, they have to be standing outside, and sometimes not even in the medical facility. They have to be standing outside in the parking across the road from the medical facility. And this is, again,
Ashley, just stop for a second. We agree with you. I'm sure Reverend Franklin agrees with you as well. So this is exactly what you raised as well.
To a certain extent, I would agree with Ashley Potts on this. But may I say that, the DA government has had 15 years of having to rectify this. And, it's been a situation that's been coming on for a long time. And we shouldn't now, because it's a election time, having to make, amends to this, to say that we're going to work on it. We mustn't forget that the DA is ruling in the city. And this is obviously one of the biggest concerns of the community, having to say, and that this has been brought up on numerous occasions in the hospital board, in the city per se, to deal with these matters, and nothing has been done about it.
So here's the question, right? The challenge which I have is that it's often the politicians have got wonderful dreams, but the actual workers in Reverend Frank, the ANC couldn't even pay their own workers. Now, if the ANC can't pay its own workers who are political party workers, when we take a look at the number of, and I understand, I have immense respect for your contribution within our ward, within Mitchell's Plain. And so if I separated Reverend Franklin from the ANC, I can expect a certain amount of work from the individual. If I separated Ashley Potts away from the DA, I can expect a certain amount of work from the individual. But the challenge really comes down to knowing that over a period of time, it comes down to the operational staff. And the big challenge is that Department of Health is a national budget. It is not a sort of Cape Town budget. And providing that kind of health service where you as an individual don't have control over the operational staff, and neither can you influence the budget, how much can you actually promise to do over the next 5 years? Ashley, do you want to go first?
Thank you so much for that, Sachin. So the reality is that, I mean, I have on numerous occasions, because of the substance use disorders challenges that we face in working with young people and adults alike, dealt with medical management. And as much as you look at other competencies such as our South African police services as well, these are all national competencies, and national policies has been deployed to ensure that service delivery is almost enacted. But when it comes to delivery of the service, my challenge is, and Reverend Franklin sits on the board of the health facilities, and I know that this is something that they always fight for and work towards, but the management may decide to do something, but we have some things that is basic, I mean, really basic, as having an intake or an assessment done at a medical facility such as the Mitchell's Plain Day Hospital, and you don't see empathy to the point of understanding the plight of those seniors, because they are not being treated humanely by the frontline staff. And so this is quite a challenge, because yes, the operations has been set and the policies has been put in place, but still the daily operations is what is being challenged and questioned. Why can't humane basic services be rendered to our seniors and to any of our citizens that has to use the day hospital, who does not have private medical aid to be able to get their needs met? So my challenge lies with the frontline staff, the administration staff, the security staff that is not even from the area where the medical services is rendered. And so they do not engage in a way that is empathetic to the need of the ma, the granny that is standing outside there, that doesn't even get offered a chair to sit outside. And so, I mean, simple things that the Democratic Alliance can be assisting with, which we've been asking for, is to be able to put some cubicles outside, put some marquees outside, and this has not been met with acceptance by management of hospital facility. So these are challenges, real. You muted, Mr. Atchin.
Yes. So, Reverend Franklin, the question is, I mean, Ashley is saying that he's almost sounding as if he's coming from the ANC at this point in time, asking why it is that the ruling party in Cape Town can't at least do certain things, you know. It sounds a lot like he's sitting on your side of the fence here.
Yeah, let me say that first of all, I'm the chairperson of the district hospital board.
Oh wow! So you actually are responsible for the hospital board, while the DA is responsible for nothing.
Yeah, you must remember one thing, that there are different boards in this sector. There's a board for the day hospital boards and clinics. There's a board for the psychiatric hospital, and there's a board for the district medical hospital. So, unfortunately, I don't have any inroad to the day hospital, but I do have a voice as a member and a public citizen in this city to raise my voice to the plights that we have at the day hospital.